Hi, I'm Kristen Adair. This is video number 7. This is my journey to surgical correction for my Pectus Excavatum. In this video, we'll go over my most important appointment, which is going to be with the actual surgeon. So this might be a longer than normal video. So my surgeon is Dr. Dawn Jaruzelski, and I don't know if I'm saying that right, so we'll call her Dr. J. She is at the Mayo Clinic in Phoenix, and she is actually the only surgeon in the state of Arizona that performs the minimally invasive Nuss procedure on adults for Pectus Excavatum. There are very few actually across the country that do this procedure on adults. And so I got very lucky that she actually lives here just down the street in the Phoenix Mayo. So definitely want her as my surgeon. She's done hundreds a year for a few years at least now. She is considered the expert in this procedure. So on August 16th was my appointment at the Mayo. When I went there, I first went into the room and they sent in one of the nurses that actually works in the operating room with Dr. J, and she handed me one of the Nuss bars to hold. So with the Nuss procedure, I'll do a separate video on exactly what that is as well, but basically they make 2 small incisions on both of your sides. One incision they put the camera in, and the other is for the bars. So they take a metal bar, and it's exactly as long as your chest this way, and they will be inserting it all the way across your chest through that hole, and they come straight, and they have a machine in the operating room that will bend the bar to your body, so exactly how they need to bend it. And when she inserts it, it's going to go curved in just like how my chest is now. And so it'll be all the way across, and it will be kind of going across where my organs are, and then the ribs on the other side. So then once they get them across, they'll use 2 to 3 bars, just depending on how many she needs. When she gets in there, she'll know. And when she gets them across, she'll flip them. So it will pop my chest out, and then she'll leave them there kind of like braces. So they hold everything out. And once she gets them in the position, she takes this certain kind of string and ties the ends of the bars to your rib cage, so that way it doesn't move around and it stays in position. So she let me hold the bar, and it's like this thick. It's not a small bar. It's not really super light, and I got to hold it, and she basically just went over the procedure, and my CT scan with me and my parents. My parents went with me for support, so that was really nice to have them there. And she basically explained my CT scan, which we already went over in my video previously, but you know, the severity that I am severe and what it's doing to my heart and the compression and all of that. And so she said basically I need this surgery and I will benefit from it, and this is something I need to have or else I'm going to have a shortened life. So she said they don't like to push anybody into this procedure because it is very major, so I need to be sure that I'm ready, which I am. So after she was done talking with me, I also met with Kelly Myers. She's the Pectus program coordinator that we already talked about earlier in my other videos. And she basically helped me with insurance stuff. The Mayo doesn't take all insurances, so you'll want to make sure that you check with that before you try to go there. They're very expensive, so even if they do take your insurance, it can be quite expensive. I also met with, they usually at the Mayo, they have a resident come in before the actual doctor. So it was Dr. Sims who came in, and she's very nice, and she did a very long detailed history with me, and again talked about the procedure, answered some questions I had, and then at the very end Dr. J came in, and I had seen her on a YouTube video or 2, and she was awesome. Just like I expected, super friendly, very down to earth, easy to talk to. She spent a lot of time with me, answered all my questions and my parents. So basically the bars will stay in for no less than 3 years, and when they're ready to come out, it's an outpatient surgery and they'll just take them right out. You'll have 1 x-ray a year usually to make sure that they're in the right place still, that they don't need to change anything, or that they haven't moved. one of my really big concerns was having children. So she confirmed that once you have those bars in, you're good to go. If you want to have kids, you're perfectly fine, healthy, it's okay for you and the baby. And she said she's actually had a patient that's had twins before with no issues whatsoever. So that made me feel really happy. She also said as far as recovery, I will only be in the hospital for 2 nights inpatient, which was awesome because I had seen some stuff online about the ravage, which is the other procedure where they just cut your chest wide open. And I heard some people talking about a 5 to 7 day hospital stay, so I was really relieved when it was only 2. And she said they're going to be very aggressive with pain management because it's supposed to be one of the most painful surgeries that there is. So I'll have a thoracic epidural for the 2 days I'm in the hospital, and I will also be on gabapentin and then 2 of the oxy drugs, which I don't even know what they are, and then a high dose of ibuprofen. And then she said in the hospital it's very important that you're up and moving quickly because if you just lay there and don't do anything, you can build fluid up in your chest from having a surgery in that area. And if you do that, you can have pneumonia and just die like that. It's hard to recover from in the hospital. So she said they want you up and moving as quick as possible, so they give you enough medication to help with your pain but not make you numb to the point where you can't get up and move. So then she said as far as work goes, it's kind of up to you. Everybody's different, but you could have 2, 3, 4 weeks off, whatever you think you might need. She also said as far as going back to the gym, wait 4 weeks and then you're good to go, and you can do Pilates, spin class, yoga, whatever you want. As far as weightlifting in the chest area, she said wait 6 weeks and then just be careful. For the first 6 weeks, I'm not allowed to lift anything more than 10 pounds. And she said you'll know what you can and can't do because you'll feel it. And then as far as my bars, I am 5'7", 113 pounds, and she said because I'm skinny, I will feel the bars always. That's just how it's going to be. She said it won't hurt down the road, but I will just always know that they're there because I'll always be able to feel them. She said, I asked her about bracing, and she said that, so with Pectus Excavatum, because your chest is caved in, everything kind of comes this way, so your ribs can flare out at the bottom and stick out, which mine do, not drastically, but they do. So once she pops everything out, those ribs at the bottom should go downwards instead of sticking out. So that rib flaring should go away. And she said it's up to you if you want to wear a brace. They're not cheap. They're about $600, and you can wear it for 6 months after surgery. And that can help just push everything down. She said it's up to you, or we can wait and see what happens. So she said I probably won't need the brace just because I don't have severe flaring. I have just a little bit of flaring. She said she did just a quick examination. I didn't even have to change. She just did really quick, and she said that, yeah, you've got quite a big hole there. And she said, but I think everything's going to turn out perfect, and you're going to have a really great result. So I just was really impressed with her, and I felt so comfortable. And I told her I'm not even nervous about the surgery. I just want this, done with, and I'm excited because I feel like I get a new chance, and I'll probably be a new person. So, and she said, yeah, when you wake up from surgery, you're going to feel all this tight pressure from the pain, but at the same time, you're going to be able to actually breathe, and you've never been able to before all the way, and you're going to be amazed by how it feels, so you won't even notice the pain. So that's what I'm looking forward to the most. So after that, that was pretty much it, and once I got some insurance things straightened out, I was able to schedule my surgery, and I had to prove that I had to get an exception with my insurance because they didn't take my insurance, so that was a little bit of a challenge. So we're still working some things out with that. So my surgery date is scheduled for November 8th, 2013, and I have all of my pre-op appointments scheduled the day before on the 7th. So as long as everything goes as planned, that will be my surgical date. And I do plan on doing a video explaining exactly what the Nuss procedure is. I'm also going to put a link, and you'll also find the video on my actual website, my blog website, for the video from the Mayo Clinic explaining Dr. J's Nuss procedure. They'll have an actual patient talk and then Dr. J, and you'll get to see some images, and it's pretty cool. So I'll put that on there as well. And I think I'm going to cut it off here. So until next time.